The POSEIDON study was investigating a combination of chemotherapy of 4 cycles with durvalumab or durvalumab and tremelimumab compared to 6 cycles of chemotherapy alone in a large phase 3 environment on first-line stage 4 non-small cell lung cancers without EGFR or ALK alterations. So the study had this 3-arm design, and there were some particular aspects which should be mentioned in this context. First of all, there was a combination of 4 cycles of durvalumab and tremelimumab, not 2 cycles as compared to a previous other study. Second, tremelimumab was restricted to 5 applications only, 4 applications with chemotherapy and durvalumab, and 1 application in the maintenance phase together with durvalumab, and then it was subsequently followed by only durvalumab maintenance, this therapy arm. And finally, there was a variety of chemotherapy combinations allowed in this protocol, which was also kind of unique compared to other studies. The results were that the combination of chemotherapy plus immunotherapy was superior in regard of progression-free survival, and this was particularly pronounced in the combination with durvalumab and tremelimumab, also regarding overall survival in combination with chemotherapy versus chemotherapy alone. The combination durvalumab and tremelimumab with chemotherapy led to improved response rates, duration of response, and as I said earlier, progression-free survival. Interestingly, if you look at subgroup analysis, in particular patients with non-squamous histology seem to benefit from the combination durvalumab, tremelimumab, and chemotherapy. Later, some exploratory analysis were done and looked for patients which may be hard to treat and have been associated with lack of efficacy with the addition of checkpoint inhibitors in retrospective studies, such as patients with non-squamous histology and KRAS, KEAP1, or STK11 mutations. And in the POSEIDON study, 96% of patients had been evaluated with non-squamous non-small cell lung cancer regarding the efficacy with the analysis of KEAP1, KRAS, and STK11 mutations. And indeed, the benefit of durvalumab and tremelimumab with chemotherapy versus chemotherapy alone was more pronounced in patients with mutations in these 3 factors. Underlining that these hard-to-treat patients may be particular benefit from this kind of regimen. So at the ELCC, I was proudly allowed to present on behalf of co-authors some further exploratory analysis investigating the use of 4 versus 2 cycles of chemotherapy in the combination with checkpoint inhibitors. The majority of patients did receive, like 80% of patients did receive at least 4 cycles of chemotherapy in the chemotherapy plus checkpoint inhibitor arms versus chemotherapy only. The chemotherapy only arm, only 74% had 4 cycles or more. The response rates were superior in all histologies, in particular non-squamous histology versus chemotherapy alone arm. And interestingly, most patients did demonstrate a further benefit in the shrinkage of target lesions if you look from 2 versus 4 cycles chemotherapy, meaning that the 2 additional cycles of chemotherapy did result in a further shrinkage of the target lesion sizes. Moreover, about 26% of patients went from stable disease to partial response when treated with durvalumab, tremelimumab, and chemotherapy, and about 90% of patients who had a receipt of partial remission or complete remission after 2 cycles remained in partial remission or complete remission after 4 cycles. And very finally, again, in these patients with STK11, KEAP1, or KRAS mutation, the response of chemotherapy was again more improved if you look from 2 versus 4 cycles when treated with durvalumab and tremelimumab with chemotherapy. Well, the 2 additional cycles of chemotherapy did not result in higher toxicity, meaning that if the patient is able to receive 4 cycles of chemotherapy with durvalumab and tremelimumab, I think the patient has benefit from these 2 additional cycles and may also be able to stand these 4 cycles. Of course, if there is a major toxicity, one may think about limitation, but nevertheless, I think these results demonstrate that 4 cycles is doable, at least in the study context, and also does result in higher efficacy as compared to 2 cycles only. In summary, of course, the durvalumab, tremelimumab, and chemotherapy combination is a new, now approved approach in stage 4 non-small cell lung cancer in Europe.